And then we check your urine. All right. So all of these are all the vital signs that are checked to make sure that everything is fine. And this is the reason why you come for antenatal, because this you cannot check on your own. And I can tell you that all of these informations, they're all very important. Starting with the blood pressure. Next slide. Hypertensive disorders in pregnancy is one of the major causes of maternal mortality and maternal morbidity, meaning that of the five major causes of a woman dying while she's pregnant or 6 weeks after pregnancy, hypertension in pregnancy is one of them. But it is the second leading cause after hemorrhage. That is why it is very, very important that when you are pregnant, your blood pressure is monitored regularly. Regularly. Why? Because pregnancy can induce hypertension, meaning that a woman has never been hypertensive before, blood pressure was not high, and suddenly because she's now pregnant, the blood pressure now starts going up. That is called pregnancy-induced hypertension. Now there are those who are already hypertensive before they got pregnant, and when they got pregnant, that pregnancy can now may worsen the hypertension. And so for that, it's more of a chronic hypertension. Okay? So for these different categories of patients, we need to ensure we monitor your blood pressure. And that is why each time you come for your antenatal, you must ensure that your blood pressure is checked. You should know what the normal values are. Anything less than 140/90 is normal, generally speaking. However, we also pay attention to differences in either the systolic or the diastolic blood pressure. What do I mean? If a woman has a normal blood pressure of 80/50, and then she now comes and blood pressure has now become 130/80, yes, generally that blood pressure is normal, but for that particular patient, it's not normal. Something has happened. Why? Because she was 80/50 before. Now she's now 130/80. Okay? And so we need to pay attention to that. All right? So that is why you must ensure that whenever you come to the hospital, your blood pressure is checked. And once you come in, you don't come in straight and go straight to the vital signs room to rest. 15 minutes to calm down. So some women, when they are coming for their antenatal, they are driving like this bomb. They are trying to beat, I'm coming, I'm coming. Tell doctor I'm coming. Calm down. So when you come into the office, into the clinic, just relax, sit. And after 15 minutes, you can go and then your blood pressure will be checked. So like I said before, next slide. Typically, we use the left arm. Okay. Measure both the systolic and diastolic. Systolic should be 90. Diastolic should be less than what? 90. Anything above that means that your blood pressure is high. Okay, next slide. All right, so this is okay, so this is the blood pressure. Now there are patients who will say, doctor, my blood pressure is 80/50. It's very low. No, for some patients it's not low, particularly when you're pregnant. All right, as long as you're not dizzy, as long as you're perfectly fine, all right, and you have a blood pressure of 80/50, fine. You've not lost fluid, you've not been vomiting, you've not been stooling, you're not bleeding, all right, and that's just your blood pressure, and you're perfectly healthy. It's okay. Why? Because during pregnancy, there are pregnancy hormones that brings about dilatation of your vessels and lowers your blood pressure. There's a lowered resistance. Okay, so don't panic when you take your blood pressure at home and you're having readings of 80, 90 systolic and 50, 60 diastolic. All right. Next slide. And then the next vital is the pulse rate. Next slide. So that's your pulse. That's talks about the flow of blood in your vessels. Okay. Generally, when you are pregnant, your pulse rate tends to go up. That's why some of you will notice that your breathing is a bit fast. Your respiration also goes up. When you walk a bit of a distance, you start panting. If they take your pulse rate, your heart is beating. Right? Pregnancy is a hyperdynamic state. Okay? It increases the blood flow. Your blood flow literally increases up to as much as 40 to 50% when you are pregnant. Why? Because your body is being prepared for delivery. Because the body knows that when you are going to deliver, you certainly lose blood. So it increases the volume so that even when you lose a bit of blood, it's fine. All right? And so we expect your pulse to increase. Normally it's between 100, between 60 to 100.